Good morning, good afternoon, everybody. Welcome back to another MedFit Education Foundation webinar. We're happy to have you here today. Very exciting topic. Today is the new special population, the role of group fitness in drug and alcohol recovery. We have Nicole Golden with us today. Nicole is excited to be here with us, and we're excited to have her. Nicole has been a health and fitness professional since 2014 when she left the field of education to pursue a full-time career in fitness. That sounds familiar for many, whether or not it's education, but we have a lot of people here who have discovered their way and found their way into our field. She's a NASA master trainer, and she's the owner of FWF Wellness. She works with a wide variety of clients, including female athletes, cancer survivors, older adults with medical comorbidities, and clients who have undergone bariatric surgery. Lots of medical fitness here. She also has a special interest in coaching clients in recovery from substance use disorders, which is why we have her here today. She's the author of MedFit Classrooms, Drug and Alcohol Recovery Fitness Specialist online course, and that is the first course of its kind, providing fitness professionals the education required to work successfully with the drug and alcohol recovery population. Nicole, it is an honor and a pleasure to have you here with us today. I'm going to share the screen with you and you can take it away.
All right, guys, welcome. I'm really excited to be giving this webinar today. I'm going to go ahead and start my slideshow here. All right, so the focus of today's webinar, even though there's a lot of information in the drug and alcohol course, is really a focus on group fitness, because I wanted to take one aspect of the course and something maybe you can apply in your own practice. So the title today is the new special population, role of group fitness in drug and alcohol recovery. So let's go ahead and take this away, get started. Here's some of your learning objectives. This is what I want you to get out of the webinar today. So really, I want you to just get, a quick understanding of some common comorbidities. Obviously, there's a lot more information in the course. Really understand and be able to explain to me the benefits of a regular exercise program when you're in recovery from substance use disorder. We're going to talk a little bit about how to do modifications and how to present your classes, because there are a lot of physiologic considerations when designing exercise programs in this population. And then motivation being a really big piece as well. Just give you guys a couple of strategies to be able to motivate your people. So let's keep going here. Brian, go ahead and play a video. I want you guys to hear from some of my staff and instructors. We've been working with this population for 6 years now. Take it away, Brian. I'll let you hear it right from them.
So how did you feel as a brand new instructor going there for the first time?
I was scared going the first time. I actually, was asked to go for a couple months before I actually gave in, because I was just really nervous about it, not knowing what to expect. And so eventually, I thought, okay, I'm going to try it. But the whole drive out there, I remember having butterflies in my stomach and being I just had no idea what to expect when I got there.
So how was that first class? What happened?
It was great. They were just excited and pumped up, and they're like, oh my gosh, this is going to be so cool. And even afterwards, they all were thanking me, for kicking their butts and making them sweat. And I just had that, I remember driving home with that high feeling, I had chills on the back of my neck, feeling oh my goodness, that was just the best experience, feeling that I gave them a feeling of I can do this. And it was amazing.
Awesome. So tell me about what that first class was like. How did you feel working with this population? Were you nervous?
Yeah, I was definitely nervous. It was definitely something I wasn't used to. I didn't know what I'd be walking into or what my expectations would be, so I just kept an open mind. And it turns out it's one of the greatest things I've ever done. And it was definitely nerve-wracking though, just because I wasn't sure what their skill level would be, their fitness level. So I just kind of went in, like I said, with an open mind and had some backup plans if I needed it. And just once I got through that first class, it was all pretty smooth sailing from there, I'd say.
So I guess my experience is a little bit different in that, because I was familiar with the recovery community before I started teaching in the rehab for about 5 years, I've been pretty close to the recovery community where I live, although I'm not in recovery myself. A significant other and some of my best friends are in recovery. And so the fitness part came second. So I decided that I wanted to bring fitness to the recovery community. So in that sense, I was pretty comfortable going into the rehab, having had lots of personal experiences with the AA and NA program before I did that.
And so you come at it from a little bit of a different perspective, because a lot of our instructors, the first time they went, they were freaking out. I'm sure you were just like, you were with me, we were together. You're like, I got this, this is no problem. Okay, so in 2016, the way we got started working at Bradford Recovery Center was I was working for a local YMCA, and they had asked me, hey, will you do a class at a drug rehab? And I thought, oh, well, I don't know anything about working with this population, but you know what? I'm going to give it a try. And I was the only instructor that was willing to do it. And as you can see, there's a little apprehension in the beginning because there are a lot of skills that you really need to work successfully. A lot of it for us was, yes, we had a background in exercise physiology, lots of trial and error. So there was a lot of stigma in working in a rehab with a lot of instructors, but eventually we got started. And they absolutely loved the classes. We figured out what worked, what didn't work. We figured out what challenges were going to arise, how we had to modify our programs. And what I did was I took 5 years worth of experience and put it into the drug and alcohol recovery fitness specialist course. So when I was going early on, I thought, to myself, oh, maybe I'm not being successful, this isn't working. But the counselors would come up to us and they would say, hey, when you guys are here, this is the only time that the patients are smiling. And that was very powerful. And again, like Kirsten, my instructor, had said, sort of gave me chills down the back of my spine when I heard that. And it was a lot of motivation to keep going. Really, we saw such a huge change from week to week with the people we were working with in the recovery center. So now that you kind of know how we got into this and what our experience is, let's get into the nitty-gritty and talk about the basics. What are the benefits of exercise? So huge benefit of exercise, and any of you who have taken the Parkinson's course will also see this, new neural pathways are created in the brain. And when you learn about drug and alcohol and what it does physiologically to the body, it does a lot of destruction with your brain chemistry. The structures of the brain can be damaged, and exercise can help create new neural pathways to help in that repair and neurological functioning. It also strengthens the immune system. And if you want to take a look here, improves your cardiovascular health, which is a huge issue for especially people who are stimulant users. Normalizes sleep patterns, sleep issues, major problem for people in recovery. Improves self-efficacy. Now that one is really important, especially when you're trying to prevent a relapse. Self-efficacy or lack thereof is a huge trigger for addiction, especially with drug and alcohol. So that's something that's really important. And of course, last, building healthier habits. But all of these benefits are huge for anybody, but especially important for those in recovery. So here's where I'm going to go ahead and pull some of the research for you and then sort of compare it to our experience. So when talking about accountability, consistency, all of these great benefits, there's a lot of research. And at the end of this, if you want to read any of the studies, they are cited at the end of this presentation, really helps with that in the beginning stages of recovery. It builds a sense of camaraderie, and also it's built on peer support. It really does help that whole peer support and support that AA model where you're with peers. We notice in our experience, as compared to these findings in the research, what are we seeing on the ground? Class participants definitely notice when somebody is missing. If we come to class and someone's not there, a couple of the other patients will go out and try to find them. Hey, where are you? You need to be in class today. They definitely encourage each other. They like to bring new participants in, and they reassure them. There's people that are very nervous. They feel very vulnerable. Their peers are definitely a huge support in reassuring them. It's very common for a lot of positive energy to be in the room where everybody is cheering each other on. And it's really helpful for those in recovery. So now professionally led classes are a better environment because they're safer, you have a professional watching. They also increase adherence to exercise. Now, I'm sure a lot of you guys know that adherence to exercise is really huge and a huge issue for a lot of people. Found in my practice and being a personal trainer, group fitness instructor for 7 years, that those who are here and with us are more adherent to a program than those who aren't. That's true in the recovery community as well. So bear in mind, in our experience, many of the patients have never exercised before. There are people that have experience with exercise, but the vast majority had not. We also had a good understanding of how to minimize injury or negative experiences from exercise to keep people coming back. And, you know, teaching proper form and technique so that they can enjoy exercise long after they're discharged from a recovery center. So let's talk about exercise modalities. For us, this was definitely a huge learning curve because some formats worked and some didn't. We tried everything from Zumba, pound, kickboxing, yoga. We generally settled on about 4 or 5 that the patients really, really responded to. So this depends pretty heavily too on the substance used. And just a little snippet from the course, people who were primarily addicted to opiates tend to have a hard time with high intensity exercise because of a lowered pain threshold. Individuals recovering from alcoholism tended to have a lot of trouble with things that require a high level of skill, like single leg exercises, lots of balance and coordination. People who were stimulant users primarily did very, very well with high intensity exercise as long as we were careful to screen them for any sort of cardiac issue. Now, this is not always true. These are just sort of generalities, but things that you want to bear in mind when people are in your classes. Also, providing a decent variety of exercise modalities, something that sort of appealed to everybody, is hugely important. So just having the same class every day, probably not terribly helpful because everybody connects to a different format differently. So we provide a pretty wide variety, like I said, maybe 4 or 5 core classes, and we'll throw something new in there once in a while. And varying it, being there regularly, and allowing them to have an opportunity to practice really helps with the adherence. Things that the research shows that I don't necessarily have in this slide that tend to do very well, pound. I don't know if any of you have ever heard of that format with the drumsticks. That one was a very versatile format, really connected with people. Running is one that's very popular for people that have had a history of substance use disorder, especially because of the camaraderie that comes along with it. And yoga, believe it or not, yoga and meditation was there's a lot of really, really good research to support that. So structuring new habits is something that's really important as somebody's coming and becoming ready to be discharged from a drug and alcohol recovery center. So having this structure already in place and giving patients the opportunity to support them in structuring exercise outside of the recovery center is hugely important. So what we found is that people in recovery tended to have poor structure in their life, so this provides a routine. Also, you know, the beauty of a structured fitness class is that it's, again, structured. It's not like they're going to a gym and they're just on their own trying to work out without any sort of guidance. The other thing is, you know, things like your training variables, your reps, your sets, intensity levels can be very difficult for a beginner, especially somebody with special medical needs. So having us there and being able to help them structure that was really, really hugely helpful. Okay, so now that we talked about sort of the benefits of exercise and what we did, let's talk about some common comorbidities. Now, these are very critical when you have a group of people in recovery or even one-on-one, understanding where they're coming from. So people who have been addicted to various substances may suffer from cognitive dysfunction, nutrition deficiencies, especially in the first, 1 to 3 months. Low muscular and aerobic endurance. That's something that's really huge because if you set them up for an exercise program that requires a high level of endurance, maybe something very high intensity, you may be setting yourself up for failure. Hyperalgesia. So hyperalgesia means a hypersensitivity to pain, sort of ties into that low muscular endurance and aerobic capacity. But remember, if somebody may say in the class, okay, my rate of perceived exertion for this exercise is a 5, somebody suffering from hyperalgesia may say, ooh, it's a 10, I have to stop, I have to leave. This is a really terrible experience for me. Another thing you have to bear in mind is prior orthopedic issues and mobility limitations. A lot of the time, drug and alcohol use comes with risky behaviors. Maybe they've been in car accidents or had injuries. That's something that you really want to bear in mind when designing exercise programs. So a well-designed class is no different than a well-designed class for any population. We want to monitor the intensity level, make it appropriate. We want to monitor the physical fitness skill levels of the participant, make sure that everything is appropriate for them. You hit all planes of motion, and you have modifications available for different fitness levels. So like I discussed a little bit earlier in the presentation, a high intensity style class may appeal to some of your group. Remember, if you're in a recovery center, you're going to have some people that were stimulant users, some were heroin users, some are alcoholics, but you may have people that are using all the substances together. Just know that if you're going to choose a high intensity class, that might appeal for to a couple of people, but to most people, especially those that have hyperalgesia, this may not be a good idea because you're going to end up with very low motivation. You're going to end up with a high dropout rate. So remember also low muscular endurance, higher rate of perceived exertion, high intensity class, probably not a good idea. You want them to feel very successful, especially since a lot of this group is suffering with psychological trauma and they have felt unsuccessful large portions of their life. So you want to make them succeed. They want to succeed. So we definitely recommend you start with a low to moderate intensity. So, think about your rep and set schemes. If you're doing a weightlifting class, you may want to stick to, maybe a little bit higher rep ranges, but much, much lighter weights, or even moderate and do slightly lower reps. So a good starting place may be 10 with an intensity, 10 reps with an intensity level of maybe 55-ish% of their 1 rep max. Obviously, you're not testing their 1 rep maxes, but what I like to tell my people is, maybe when you're doing that exercise, think about having maybe like 4 reps in reserve. So that's if you're weightlifting. If you're doing something like Zumba or maybe a kickboxing class, you want to keep the intensity level maybe a little bit lower than you'd set it for general population. Make sure that you have a plan. You want to go in with regressions and progressions and make sure that they're appropriate. Be prepared with a different format than you would plan to offer. You may walk into go and teach your class in the recovery center and say, I came with kickboxing today, and you may find that, yeah, that's probably not, maybe a lot of people have coordination issues, a lot of balance problems. You may want to shift to a stability and balance class today. So what you want to do is make sure that you have a plan to make those transitions if needed. So you are not always going to know the fitness level. Every 28 days with these rehab centers, generally the population turns over. So there's a pretty good chance that every week you're going to see new people and you're going to see some people leave. So again, I'll highlight this again. You start with a low to moderate intensity level. Seems obvious, but some people it may not be as obvious too. So let's talk about physical fitness skills. Now we know that this can be affected. So we're looking at the skills of coordination, balance, reaction time, power, speed, and agility. So these are sort of the 6 cornerstones of what we're looking to improve. Now recall, people who have a history of alcoholism, coordination and balance, especially in the first 3 months of detoxing, may be a major problem. Same with reaction time. Speed and agility, that all sort of requires a good amount of coordination. Power is something we probably aren't going to be looking much at here, but it is something that you can include in a modified fashion. So in very early recovery, there are significant coordination issues. The exercise can help to improve that coordination, but you want to start simple. So stick with movement patterns that are attainable. So what I'll recommend is maybe just your foundational movement patterns, squats, hinges, maybe a forward press, or like a push and a pull, a vertical push and a vertical pull, things like that. Very, very basic movement patterns can really go a long way. You don't have to make a really fancy class. looking at balance, how well can a person maintain their sense of gravity? As we mentioned, in these rehab centers, these people are coming right out of detox. Balance is going to be effective. So you want to have some balance components, but again, not so many. So I love this example here of a single leg overhead press. Really common exercise. If you look at the NASM standards, it's in your phase 1 stabilization endurance choice of exercise. However, a single leg overhead press may be, not so good for this population. So maybe a single leg, maybe having them do something like put both legs down or have like a little kickstand or some sort of support might be really helpful. Single leg deadlift, probably too challenging. So you want to start simple, maybe have them just stand on one leg, omit the overhead press. So you see where I'm going with this, lots and lots of different modifications. You want to sort of work on one aspect of challenging their balance at a time. So reaction time, again, this can be something that's impaired. So reaction drills are good, but make sure they're not, too quick and intensive. So I like to use agility ladders a lot with this population because agility ladders can be simple and fun. What you want to do is start off with relatively simple drills, maybe 2 ins, or if you want to progress that a little bit, like a lateral shuffle, but make sure that you're cueing for accuracy, not necessarily for speed, because you don't want them to get all, I'm sure if you guys have used them before, they can get all jumbled up and people can get frustrated. You may find that it's good for them. If you have a patient that comes in for the whole time they're in rehab, maybe starting the week after detox, you might see some pretty significant improvement in their reaction time. Okay, looking at speed and agility. Now, one of the things we didn't talk about as much earlier in this presentation is muscle atrophy. Muscle atrophy is usually a result of not using them, obviously, but also, I better go back to my slide. I clicked it. So muscle atrophy is actually something that's very, very common because of nutritional deficiencies and just sitting around. So lots of explosive movements, maybe not a good idea, but there are some things that you can do. For instance, if you want to program in a jump, maybe a full vertical jump is not something that's appropriate, but you can modify it by encouraging the patients to raise their hands up over their head and go up on their toes, still, providing a little bit of that power stimulus, but not to the point where, oh, they have really bad landing mechanics, or maybe they're, being overly stimulated. The other thing I sort of want to touch on here is music selection. So music selection can actually be a big problem. A lot of the music that may be popular may mention a lot about drug and alcohol, and that can be a trigger for some people. So when you're making your playlists, it may not be a good idea to just play Pandora or Spotify or something like that. You may actually want to make an intentional playlist. One of the things that can also help keep your clients motivated is maybe asking them, oh, what kind of music do you like? Programming in some things that really connect with them. So anything with like a lot of violence, hypersexuality, extreme cursing, things about drug and alcohol use is probably not a good fit for use at a rehab center. Also, a word on licensing, make sure that you're either using obviously royalty-free music or carry a music license. I'm sure most of you who are, group fitness instructors already know this. Also bear in mind, keep rhythm and tempo appropriate. If you're teaching a class and you want to keep a lower or moderate intensity, you may want to pick tempos that are a little bit lower to moderate intensity and maybe not like a really fast-paced beat. If you're doing a little bit higher intensity class, maybe you have a more advanced group or a group that you've determined is more tolerant of high intensity exercise, you can change that. All right, so I'd like for you guys to hear a little bit more from my instructors about the impact. And we've been doing this since 2016. Again, a lot of them were nervous to start, but I want you to get an understanding of the impact that you can make on this population when you do this type of work. Brian, go ahead and play video number 2. So do you feel that you're making an impact?
I do, yeah. It's the greatest feeling when you leave there and you know that I love it every day that I do. I wish I could do it full time, honestly. So yeah, I definitely believe it's making an impact, and there have been people that you just kind of watch grow from maybe week 1 to week 4, and they're a completely different person than when they first walked through those doors. So
you can see the progress.
yeah, definitely.
That's so awesome.
My experience, like 99% of the time, is like they're just grateful. They're grateful to have someone in there to like work out with them and be encouraging and positive. And that's, so don't be afraid. Like, just, that's my best advice. You know, go in with an open mind, and it's a great experience.
What strategies do you use to help encourage them? Because we know that low motivation to exercise is a problem. We also know that accountability is an issue. What strategies do you use as an instructor?
So I'm able to relate the ANNA program to fitness. A lot of the principles apply. There's a lot of cute little catchphrases like keep coming back, it works if you work it. Progress, not perfection. Those things I can pull out. There's even times at the rehab and here where I have the NA big book and it's sitting there in front of me and I pull it out and just relate it to them. That's what I can do from having so much experience. But I think, you know, talking about the people and places and things that's sort of drilled in their head that they have to change, the place can be the gym that they change. So if they can come to that room in the rehab or that place in the gym and be successful, and also realize that sometimes they can get the same kinds of feelings that they got from drinking and drugging at the gym, right? And point that out to them. Point it out that they may feel like they're dying during class, but they feel better later. You know, keep following up with them. Social media, we can use a lot now to do that. Just checking in and see how they're doing. And just keep pointing back to their program for them. And also the people. When I first started teaching outside to people in recovery here at the gym, I had separate classes. I had classes for those, maybe there were people in recovery in them and I didn't know, but I had separate classes for the community in general versus those in recovery, and I decided to integrate them, and I think it's been pretty successful in that, you know, some of the people in my classes that are not in recovery actually get a ride from people in recovery, and they become friends, they become Facebook friends. And although in my classes we talk about meetings and we talk about AA and NA stuff, so I'm guessing everyone knows that there are people in recovery. I think it's been a positive experience for those in recovery to see that they can socialize with different people, and that seems to work well.
So let's talk about motivation a little bit, because this is something we need to touch on. You'll be like, yeah, Nicole, great. You told us about some modifications to make, some general principles, but we can't motivate people to come to our classes. Initially, when I first started working at the rehab, we had some difficulty getting people to come to class. They were afraid, they didn't know what to expect. And again, it was a change in the routine. These patients need both intrinsic and extrinsic motivators to keep them wanting to come back to your class and to stay motivated. So you may find that if you go, you may have people like leaving halfway through class, and you want to kind of avoid that, and it happens, but there are ways and definitely strategies you can employ to help them. So goal setting for the class. At the beginning of class, you want to walk in and say, okay, these are our goals for today. And thinking back to many of your personal training certifications, what are one of the things we talked about were SMART goals, right? Like things that are, you know, specific, measurable, attainable. Those sorts of principles you want to have for the class. Make them feel like, here is a goal for you for my class today. We don't want to set a goal for 4 weeks out. We want to set a goal for right now. Again, that's something that you'll see with drug and alcohol recovery over and over again, are shorter goals, but something that's very attainable for them. So an example of that would be, okay, my goal today is for all of you to be able to make it through at least 50% of this class. Or my goal is for you to make a new friend today in this class. My goal is for everybody to be able to do X amount of squats, maybe 5 squats, but something that's, again, very attainable. You want to build rapport amongst the peers, because again, they're gonna be with those people 24 hours a day while they're in that center, and their peers are really, really going to help to keep them motivated. And you want to sort of also identify that class cheerleader. There's always going to be somebody in your class that's going to be very motivated, and they're going to help to cheer on everybody else. Here's a couple of instructor tips for you when building rapport with this group. So treat them the same as you would any class participant. Don't look at them differently because they're in recovery. You want to be as judgment-free as possible. Just treat them, you know, hi, my name is Nicole. I'm your instructor today. What's your favorite fitness move? What kind of music do you like? Just something very, very similar to how you would treat anyone else. Take a very big interest in who they are individually. Learn everybody's names. And I heard this from a lot of people in the recovery center where they would say that they felt that they were very unimportant to people. So when they're coming into your class, I know it may be difficult when the population is changing over, but really taking the time to learn their names and greet them by name when they're coming in is going to be a huge, huge help to their rapport. Ask where they're from. Everybody's coming from a different place. Usually they're placed in rehab far away from home. So maybe talk to them a little bit about home. Try to really take the time to build a connection with them. And this is more important with this crew than it is with the general population. Don't ask them why they're there. They may very freely offer up information about why they're in the rehab center, but it's not something you want to really draw attention to. And definitely, this may seem really obvious, but it's not always so obvious. Somebody has like a specific medical issue, don't single them out in the class and point it out. You want to really avoid any sort of embarrassment and make them feel really comfortable. So what can you do with this knowledge? Like, why take this course? Why work with this population? Some of the students who've taken the class already have begun working in inpatient drug and alcohol rehab facilities. Another thing that you can do with this information is you'd be surprised how many people who are coming into a regular gym or a regular facility have come from a place of drug and alcohol addiction. I have a number of personal training clients myself that have had a history of substance use disorders, and it still affects their training, even though it's something that wasn't readily apparent or something that happened a long time ago. It's still something that you need to bear in mind. A general class like Shannon had talked about can be very appropriate. Just, you know, you'll get to learn about your class, apply some of these same principles, and just bear in mind that they can be there. Exercise therapy, when we dive deeper into the research in the course, we talk about what exercise therapy is and how it provides an excellent adjunct to the therapy they're receiving. You can work with the treatment team. You can be a member of the treatment team. And they may have a sponsor, a psychologist, a dietitian, and a fitness instructor or personal trainer on their team to help their recovery. And some of your facilities, if you choose to, you know, go forward with the training, you can become eligible for grant programs targeted at prevention and treatment of substance use disorders. So lots and lots that you can do as a drug and alcohol recovery fitness specialist. And again, the reason to get this information, take this course, is really so you are going in there with the knowledge already, not trying to figure it out like we did in the early days. So that's all I've got for you guys today. I'll love to open up the floor to some questions. So go ahead and ask away anything that has to do with group fitness, and I'm also happy to answer anything about drug and alcohol recovery and fitness in general.
Excellent. Thank you so much, Nicole. That was a great presentation, and I want to. We do have some questions for you. I always. It's a funny thing. I've got some history myself, and you know, I always struggle, not struggle, but I just always try to bring it out when appropriate, and you know, leave it where it is when it's not. And you know, I've been in recovery a long time, and exercise and fitness has been. You know, I always say it didn't save my life, but it certainly gave me a better one in dealing in everything that I had to do. So first and foremost, I love everything that you're doing. It's tremendous work. You're very thorough. It's very helpful to people who need it, and there are plenty of people who need it. As you said in your title here, it's the new population here, especially with COVID and everything else that we're seeing a whole lot more from that aspect. So thank you for everything that you do, and your course is second to none, as we mentioned as well. So from me to you. So with that said, you know, I know some things that the recovery community does look at things sometimes differently. Exercise and even nutrition changes and anything really change related that isn't focus on self and the biggest obstacle at hand, which is recovery, is sometimes frowned upon. What have you seen as far as that? Have you seen any kickback or things from people who maybe say now's not the time for this, especially early on, like in a rehab facility?
Are you talking about the counselors or the patients?
Counselors. Yeah, counselors. I would say that, they sometimes they'll tell you like, now's not the time to quit smoking either. It's like, smoke all the cigarettes you want. We're going to focus on the alcohol. We're going to focus on the opiates. We're going to take care, tackle the biggest problem first. And, and jumping into an exercise routine sometimes is not suggested.
And it's funny that absolutely we see that. In fact, I'm working with another gentleman and presenting at another conference come November where we're supposed to be addressing a lot of these counselors and psychologists because we don't have a lot of buy-in for this. There's tons of research that shows that in early recoveries, when you want to hit it, that's when you want to begin introducing an exercise program and healthier habits. But we do see a lot of pushback. Either it's not something that's that's considered to be important, or like you said, it's something that's considered a bigger change. It's funny you bring up the smoking because we see that all the time. There's always cigarette breaks. Most of the time people are coming into our classes right after a cigarette break. So there is a lot of focus on just the one problem, but not looking at the whole self, not looking at wellness, not improving nutrition or exercise. So absolutely, it's just a constant struggle. If you look at it, why doesn't every rehab center have an exercise program? It's fewer than 10%. It's fewer than 10% offer any sort of exercise programming, and think about all the good that it does.
Absolutely. And for me, and I know for many, it was the early stages of boredom in recovery. I spent a lot of time doing what I did. And now I have lots of time, and idle hands are the devil's workshop, right? And I don't necessarily know what to do. I wasn't in a rehab facility, but I didn't necessarily know what to do with all this time that I had that I was, hoping to spend wisely and stay out of trouble. So I think that having, a positive something to, resource or something that I could, let loose some energy and some things like that, was very important, at least to me, and I know to many others. So kind of occupying the time wisely with a, positive behavior is something that many can latch onto. But with that said, we are talking about behaviors, for better or worse, and exercise can be awfully addictive. We've seen it from people who don't have addiction issues, chemically induced addiction issues at least. What are your thoughts on that? Is it ever an opportunity? I'm playing devil's advocate here. I'm a big fan again, but is there ever anybody, any thought to that where we're kind of introducing a behavior that can also be abused in just the same way?
We've actually seen that. We have seen that happen before. It's much more rare than you might think to convert to an exercise addiction, but that's part of the reason why introducing appropriate exercise technique, appropriate recovery, appropriate nutrition, appropriate structure early in recovery is really important, so that we teach them about that right away so it doesn't become another outlet for addiction. We also do have to realize that addiction in the brain, it's a pathway that once it gets kicked off, it's kind of really hard to make it come back. So there is an element of people who are recovering are always an alcoholic. They're always a drug addict. Addictive behaviors are something that you may see again and again and again with this population.
And that's fantastic. And I think that if we, if we teach people, and something that I, point out to friends, who are in similar situations that I've been in, is to understand your own behavior, and these are things that are taught in rehabs. Understand the triggers, understand things that could put you in a position of good behavior or bad. Like I said, it works both ways, and really understanding that you have to be an observer of your own behaviors and of yourself. I'm an endurance athlete, and there are plenty of endurance athletes and Ironman and triathletes and marathoners and you name it, runners, trail runners that are in recovery. And you know, and I have run alcoholically. I have trained alcoholically. I have, you know, been obsessed, and you know, and just because it's, you know, I guess seen as a positive behavior, or something that is, you know, an enhancement to me as a person, you know, that doesn't mean that it can't be abused. So what are your thoughts? I mean, you're seeing them a lot in the facilities, outside of the facilities, when you do have your classes, or your, you know, your trainer had mentioned that she has, you know, general population, normal people classes too, that they come into. So when you see that maybe perhaps happening, is it something that you would point out? Is it something that you would ask them what their thoughts on, or, you know, would be?
And that all goes back to that rapport building. When
Yeah.
you're building a rapport, and when we have clients coming in, especially our clients that are training with us, we ask them, okay, who's your psychologist? Do we get a release of information? Because when we see that kind of behavior, that may be a time to say, hey, you may want to talk to your sponsor about this. You may want to talk to your, you know, counselor about this, because we will be at a place where we can gently point it out. I had a client that went from alcoholism to binge eating, and, you know, difficult with her, and this is a person who's a professional that you would never know that they had a history
Right.
of alcoholism. And her husband was always criticizing her. Oh, you know, now you're binge. And I think it really helps to take a step back and say, okay, once an alcoholic, we had to have a talk about always an alcoholic. Now we've transferred our addiction. Let's recognize this as an addictive behavior. What strategies are we going to now use to deal with that addictive behavior? Also, maybe a good time to contact your therapist and talk about this, but teaching them good structure and teaching them to recognize when it's happening is something that we want to start very early.
I love that, because when I do detect that behavior in myself, it's a victory, that I can see it, and I can address it, and I can, you know, work with it, and whatever I'm doing, or just, you know, take a step back and do that, because that's what is taught in rehab. You know, that is what's taught in the programs, and AA and NA, and that's what, you know, we have to kind of be able to do that. And then once we have that information, what do we do with it? So I really like that. How about setting people up for success with, you know, with everything that we do? You know, if I have a group of people who aren't, or who are new to the gym, I might change a workout and go from reps to time, right? So it's on a timer, as opposed, so that way everybody starts and finishes at the same time. You know, we might do a minute of work and a minute of recovery, whatever it is, you know, we can divvy up the time. So that way everyone kind of feels comfortable. They don't have to say, oh my God, that guy's done with his 10 reps and I'm only on 4. I suck. You know, that could really, you know, I'm not in the right place, or I'm not, you know, it's whatever those thoughts are in the head. How do you kind of orchestrate the programs, or just kind of set up that?
You want to start, and like we said in the presentation, you want to start very basic. Start with just really foundational movements, nothing that's so complicated that they can't execute it. That's a really good point, like setting them on a time clock. We've actually done that before, where they would do like an interval weights class. The other thing you want to program in is extra rest time. So fine, maybe, you know, your rest interval should only be 60 seconds. Let them have a minute, you know, or I mean, let them have a minute and a half, let them have 2 minutes, that's okay. And they need extra breaks to be able to then come back and feel successful, because some of them will tire out very, very quickly. So sticking to foundational movement patterns, like you said, time is a really great one, or setting the reps a little bit lower, and longer rest intervals are a really great way to structure a class to make everyone feel successful.
I like it. I like it. Yeah, that's fantastic. I even have people that will skip this round. All right, you're gonna do rounds 1, 2, 5, and 6, right? Or, you know, they could skip a couple in between, so that way they can catch the breath and finish all together. All right, a couple things that I pointed out here. Community and fellowship is a huge aspect to recovery. It's one of the most important things. That's why, you know, programs like AA and NA are considered to be successful resources, because of the fellowship. And I love it, because in the facility, outside of rehab, there's not much choice. They're there. right? And they, you know, I think that having an opportunity, you know, as a business model to have a class that is just for these people that, you know, that they can come in and work together and be part of a community, I think is tremendously rewarding and successful. Tell us more about that. Any thoughts about that?
Yeah, and at first we were concerned about having a class that's, you know, recovery or something like that. And we had concerns that people would feel stigmatized, but a lot of the time it's actually the opposite, because you know in AA and NA, what's the first thing you're supposed to say at a meeting?
Right.
Here's my name, I'm an alcoholic, or I am an addict. And a lot of them are very, very open about their addictions, and knowing that there's other people there that are in the same boat as them is actually really important to them, and doing things as a community. So maybe sometimes what we'll do is we'll go to like AA and do a class, or encourage them to come to a class. We'll set it up right after we know there's going to be an AA meeting so they can all go together. So the stigma is really not something that discourages people working out together, though you can always offer general population classes and intermix them as they feel comfortable. But we did find that a lot of them, if we actually set up a class that said this is for recovery, we would get more participation versus a class that was just general population.
Okay, great. And then Eduardo just chimed in. So how about one-on-one training? Does that work as well? Is that something that is worth it?
Absolutely. A lot of the drug and alcohol recovery course that we put together focuses a lot on one-on-one training. So we have a lot of one-on-one clients. Things that I can point out about one-on-one training: make sure that you have a very clear medical history, a very clear psychological history. In the course, we provide forms and templates for the right questions to ask. You want to also, sort of like Shannon had said, be really familiar with AA. I know not everybody uses AA or NA, but most of them will. So be able to relate their training to AA. Other important pieces about one-on-one training: you'll get frequent cancellations. You have to do a little bit more with accountability work with this group than you do with general population. SMART goals are huge. You got to set really attainable short-term goals. When people are talking about AA, a lot of the time they'll focus on a 24-hour period. So 24 hours, I'm sober for 24 hours. Well, in 24 hours, I'm going to exercise in this 24 hours. I'm going to do my nutrition in this 24 hours. Make sure that you stick to much shorter goals than you might set. You set a goal for 6 months, like, oh, we're looking at, I'm going to lose 40 pounds in 6 months. Completely inappropriate goal for someone in this population. You know, other things to talk about with program design depends on their history and the substance used, but there are a lot of considerations that we talk about in the course and things that you have to include when doing program design.
And it was mentioned, progress, not perfection, right?
Yep.
We seek progress, not perfection. So, you know, and as long as you're going in the right direction, you know, it can't be anything but good for you. So, going in the positive direction in one area and in the opposite direction away from what was being lived, you know, the life was being lived prior to that is always a good thing. I do have a question.
One other thing I'll point out, just piggybacking off of that: the coaching skills that you have to be excellent. Like, you really, and all positive cues, positive encouragement. Don't tell them don't do that, don't get away from that. Everything has to be just very, very positive, and you will have to provide extra.
Right. And oftentimes I've found is having the clients kind of answer their own questions for you, or having them even design their program. We're there to, as trainers, and you know, I health coach as well, and it's almost like let them steer the ship. We're just kind of there to caddy almost, you know, in certain ways. So that's a very important thing. I think it's important for them to have faith in themselves that they are doing this for the right reasons, as opposed to being forced to, or you know, exercise isn't always, you know, it's not for everybody until they realize how helpful it is. It's like eating Brussels sprouts, right? You hate it as kids, but now you realize how good and tasty and healthy they are for you. You can't get enough of them. So real quickly, we do have Rick has asked, how do you get started? So let's talk about maybe from business perspective now approaching, facilities or, designing these programs and getting out there?
So some of the ways that you can get started, if you're a specialist, this is an area that you want to work in. One of the ways that we did it was we would attend some AA meetings. Let the community know that you're out there. If you work at a facility, maybe ask if you can start providing maybe free classes initially for people in recovery, sort of build up a reputation in the community. Any sort of community events that you know about, make sure that you're there, advertise well. People a lot of the time feel very comfortable coming here because they know that we're specialists. We know what they're going through. We know how to work with them. As far as a rehab center, even just reaching out to them saying, hey, I have a subspecialty in drug and alcohol recovery. I work in this population. Let me talk to you about what I can offer you, your center, as far as an exercise program goes. That can go a long way because, like I said, very few of them have exercise programs. They probably wouldn't know who to contract with if they decided that they wanted one. So all of those strategies are things that we encourage. We do have a segment of the course that talks about business development, and we've actually had some students successfully get contracts to work in rehab centers.
It's awesome. I have a friend of mine, and he's in recovery, and we exercise quite a bit, and his tagline is "feeling good helps me feel good." And sometimes we have to feel our hearts beat again, and have something positive in our lives, and just do those things. And I got to thank you for getting me out of my comfort zone a little bit with this webinar. This was not your ordinary webinar for me, but I couldn't pass up the opportunity. I kind of struggle with it. It's either the most, it's either the most interesting thing about me or the least interesting thing about me, and I'm not quite sure what it is. But sometimes a time and a place I get to discuss it, and for that I thank you very much.